Hello, my name is Cameron Fawcett. I'm a student physical therapist working under the direction of Dr. Clausen. And today I had a patient present who is 17 years old and he's 6 weeks status post a left patellar fracture. He is currently in the proliferative phase due to his pain and tenderness still occurring, as well as some of the redness. But due to his 6 week status, he will be moving into that maturation phase shortly. One of the modalities that I want to go ahead and introduce today is going to be thermotherapy, specifically a moist heat pack. This will help not only increase the tissue extensibility, but also improve blood circulation to improve healing and also decrease some of the pain that he's been experiencing as well. But before we get started with that, I do need to introduce some of the contraindications for thermotherapy, which include an open wound, an acute wound, as well as any malignancies or cancers or impaired sensation as well, in addition to excessive bleeding or hemorrhaging.
Hey Jake, how are you doing today?
Oh, can't complain. Life is pretty good. Knee hurts though, a little bit.
Knee hurts?
Yeah.
Well, my name is Cameron. I'm a student physical therapist, and I just wanted to introduce myself, and I was going to get you started on some fun modalities today, if that's going to be all right.
Oh, okay.
So you mentioned having pain in your knee. I know I also saw last time that we were having a difficult time trying to bend that knee as well.
Yeah, I can't.
So I wanted to try something new with you today. It's called thermotherapy, and I just wanted to put a moist heat pack on your knee here, just to help improve some of the range of motion and help decrease some of that pain we're feeling.
Yeah,
Does
sure.
that sound like something you'd be interested in trying?
Totally. Sounds great.
Awesome. But before we get started on that, I did want to double check with you to see if we have any issues before doing that treatment.
Okay.
Do we have any cancers, any bleeding that you've had, crazy bruising or hemorrhaging?
Nope,
No.
just an injury.
Awesome. Great to hear. And then also, are you able to pull up your pant leg just so I can better assess what our knee is looking like today, just to make sure it's nice and safe?
Yeah.
Awesome.
How's that?
That's looking great. Perfect. So give me just 1 second. Let me go ahead and grab this heat pack for you, and I'll be right back, okay?
Okay.
Perfect. Awesome. So although with this treatment, you can use a larger heating pad, because the knee is such a small area, I don't want to use the bigger one. And I opted for the smaller one instead, just so we don't overheat that area, just so you don't get too hot too quickly, okay?
Aw, that's really thoughtful of you.
Okay, give me 1 second. Let me go ahead and grab some towels to make sure we're nice and safe for you.
Okay.
So we have a grand total of 6 layers on
Ooh.
top of these, just because they're nice and folded towels.
Well, that's a lot. Why so many layers?
Just because this does get hot pretty quickly.
Okay.
So I did want to explain it to you. I know this is a heat pad, so of course it's going to get hot. But right when I put it on, it might not seem hot at all. You might be like, hey, this thing's actually pretty cool or warm. And that's totally normal. It does take some time for the heat to seep through all these towel layers, but trust me, it will. If at any point, if it gets too hot, just say, hey, Cameron, I will leave you with a little pager to page me, or just completely just take this heat pad and just put it right next to you, okay? And just take it off.
Okay.
Okay. So it will take about a minute or two to seep on through, but trust me, you will feel this heat.
Yeah, I currently don't feel anything.
Give it just a minute and it'll seep on through. Let me go ahead and give you this pager though. So we have this here. If you just go ahead and press this button, that will call me on over. Or if you just say, hey, Cameron, I'll come right on over, okay?
Okay.
Okay, so we are going to leave you on heat for a total of 10 minutes. But I do want to make sure that if you do at any time need anything from me, just go ahead, give me a call, and I'll come out and I'll periodically check on you just to make sure we're doing okay, okay?
Okay.
Perfect. You go ahead and set a timer. And I'll be right on back, okay? You go ahead and relax.
Okay.
Perfect. So how we doing over here, Jake?
Doing pretty good. That couldn't have been 10 minutes.
Not yet. So I'm just coming to see how the heat's doing. I didn't want it to get too hot for you.
Oh, okay. Yeah, no, it's good. It feels great. It's plenty warm. Nothing's going wrong.
Still just warm, not hot or burning, right?
Oh, yeah, no. Okay. It's all good.
Perfect. I'll set another timer just to check on you at that 10-minute marker then, and just to check on periodically. But again, if you do need anything, just give me a call, okay?
Okay.
Perfect. Okay, I'm back.
Oh, man, it's been 10 minutes already?
Yes, I have to be the mean person. I have to come steal this heat from you.
No, it feels so good.
Well, good. Hopefully this treatment will help decrease some of that pain that you've been feeling and also just increase your ability to move a little bit.
Okay. Okay.
But we'll get started with the fun stuff if you'd like. In just a second, you can pull your pant leg back down, but your skin's looking great.
Okay.
The little bit of redness is totally normal just because we're increasing blood flow to that area. So
Oh, okay.
absolutely normal.
Cool.
But you did a great job. And if this works well, we'll just keep on doing this when we come back next time, okay?
Sure. Sounds great.
If you'd like to, go ahead and bring your pant leg on down and we'll get started with some exercises.
Awesome.
Thank you. Just gonna put this on back real quick.